A lot of injuries this week with the Eagles, both good and bad. We'll find out what they mean. It's the injury report today, brought to you by Cape Regional Health System. Dr. Kevin McHale with Penn Orthopedics and Cape Regional. The best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. And a lot of injuries coming in on this Thursday as the Eagles put their injury report out. We're always lucky enough to have a Kevin McHale who worked in a NFL organization with the Patriots. He can really give us some great insight on how these teams handle this and what these injuries are and really how long it takes to come back. So let's bring the doc in, Dr. Kevin McHale, here on the Boardwalk Honda Hotline as we take a look at, man, it never seems to amaze us, this Eagles team over the years that we've done this. It might be you. Maybe you're causing all these injuries, right? I mean, my gosh, they've been so banged up. Have you ever seen a team, I'm sure you have in your time working with the Patriots, but it just seems this Eagles team just constantly loses guys.
Yeah, I mean, it's been brutal, especially this season especially. It just seems like everyone's dropping like flies. And, I mean, this past weekend across the whole NFL was just an absolutely brutal week. Not a Sunday we'd like to see and when we're watching sports, that's for sure.
Yeah, let's start with that. There was all these ACLs. What do you – I mean, is it just these guys? I mean, why are we seeing this so much? Is it not as common as we're making it out to be? What is your take on why this seems to happen so much more? I know the treatments are better. Guys seem to be coming back from this better, but do you have any reasoning why we're seeing this particular injury happen so much?
Well, there's a couple things. I mean, number one, this week especially, we're seeing people like such high-level athletes going down. Saquon Barkley going down, and Nick Bosa going down. I mean, when you see these kind of guys getting ACLs, it brings so much more attention to specific injury, and especially since it's a season-ending injury. So you get a little bit jaded by the fact that there's just such elite athletes that are going down and such important players across the NFL. But we see it a couple of reasons why it's such a big deal. Number one, we talked before last season about how pushing off the veterans and not letting them play a lot in the preseason and having them start really in the regular season was just kind of delaying the inevitable injuries that can occur. We see ACL injuries as one of these injuries that happens a lot in the preseason usually because that's when players are maybe not in the top form of their shape. Although they're incredibly physically fit guys, it's not game shape. It's not. They're not practicing at that high intensity level prior to getting on the field with their team and playing in game situations. So now with almost a complete lack of preseason, we're just seeing all this stuff happening now in the regular season. And there's a couple of right now. It's actually a lower number of ACL tears total compared to last season at this stage. But that's just because there was no preseason. So unfortunately, we're seeing more of them happen in the regular season. We're seeing them happen to these, really elite guys that are going down, and it brings a ton of attention to it. And just in general, these guys are just so strong and so fast. Your ACL is just not built to withstand the way they're able to quickly cut and pivot and accelerate. And it's just unable to tolerate those types of forces.
All right, let's look at the big injury here locally this week was Jalen Reagor, torn UCL in his thumb, expected to miss multiple weeks, having surgery. So what is that? What's the time frame? Do we expect him to be back?
This is another really unfortunate injury for the Eagles rookie. We just saw him. We were so happy that he was able to get back so fast from that shoulder dislocation. Now he injures his thumb. So the UCL injury, it's an injury to ligament on the inside of the thumb where the thumb meets the hand. It's really important for that grip strength you need. He is planning to have surgery, it sounds like, based on the reports that are coming out of the Eagles organization. Now, the rough estimate typically is around 6-week timeline after the surgery to return to the field. We did see Drew Brees have this procedure done last year on his throwing hand, and he was back in 5 weeks. Jalen Reagor is a really tough guy. He rehab very quickly after the shoulder and was able to get back on the field very quickly and actually played through this injury the rest of the game.
Right.
So it's very possible that he can beat that timeline, but, a rough estimate would be around the 6-week time point.
Let's go to Alshon. We have talked about the Liz Frank from him before. He practiced today. He was out there running first time in almost 10 months. So in that time frame with that Liz Frank, would you be surprised if he played this week?
I would be surprised to see him play this week, solely just because, limited participant, 1 day of practice. likely not going to be ready and, game shape to be playing this week. But it's a great promising sign that he should beat that timeline that they were hoping by activating him up. We mentioned before the season started that, by activating him, their goal was to get him back before week 6. To see him playing now, it looks like they're on track for that. While I don't really expect him to, be on the field this weekend, hopefully we'll be seeing him very soon.
Yeah, he was out there, had the helmet on, was running routes, and it was good to see Alshon back on the field for the first time in almost 10 months at Liz Frank injury. Fletcher Cox suffered an oblique injury. We don't know the extent of it, but they're really saying 50-50, and you're a defensive lineman. They said he was in a lot of pain during that game, but that seems like something that you maybe could play through, but that once the game is over, maybe that starts to irritate some more.
Yeah, there's a couple things about that. When you have these kind of muscle strains, a lot of times they're able to play through it that day. And then as the more swelling and inflammation sets in, it actually gets more painful in the days subsequent to the actual game. So it's not too surprising that there was in more pain after the game than he was at the time of the injury. Not saying that he wasn't in pain when he was playing through it on the game day. That being said, this kind of injury, it is something a little bit quicker to get back from. It is painful. It's something you can play through. Having a veteran miss 2 practices in a row, we know that he doesn't need as much time on the practice field to be able to be an elite player during a game time situation. So I wouldn't count him out completely for this Sunday. But if he does miss this Sunday, hopefully it won't be a prolonged absence. These kind of soft tissue abdominal strains can take some time to heal, but usually you can play through once there's some early healing going on.
All right, now this one, I don't know that I've ever seen anything like this. You've worked in the NFL. Chargers team doctor accidentally punctured Tyrod Taylor's lung while administering a pain-killing injection for his cracked ribs. He had 2 cracked ribs suffered in the game the week before. He played through that injury, and then I guess they were administering a pain-killing injection, which just sounds like painful enough to be able to inject the chest area, which ended up puncturing his lung. This is a rare situation, I would imagine?
Yeah, so this complication, although it's a known complication, is something we discuss with players anytime they're having this kind of procedure, it's absolutely rare. So in general, when you have a rib fracture, obviously they're very, very painful. But the fact that you have multiple ribs adjacent to them, it stabilizes that area that's broken, and it's safe to play through typically unless there are multiple rib fractures. One of the ways these players are able to play through it is you can give them a long-acting numbing medication right to the nerve that travels underneath the rib, and it numbs up that area that's broken, and with extra padding they're able to get out there and play. The problem is, as we all know, your ribs are protecting your rib cage is protecting your lungs, and if that needle goes too deep, it can allow air to travel into that negative pressure area, which is your chest, and it can lead to a small lung collapse. Now, it sounds like his was relatively small. In that he went to the hospital, he was discharged that day. It wasn't a large collapsed lung where you need a chest tube and a prolonged hospitalization or anything like that. But obviously it was a very significant complication. Although it's something that, doctors talk about anytime they were doing a procedure with, an athlete, it's something you take for granted. But the doctors are human, the athletes are human, complications can occur, and that's what happened. So obviously won't be seeing him this week, and it'll be unclear when he'll be back on the field, especially with his rookie, playing so well underneath him. But it's really unfortunate.
Now, let me ask you this. You mentioned, Fletcher Cox did not practice today. He's a veteran. Alshon Jeffery was limited today. What kind of input or little clues can we get about the days that guys practice? When you were with the Patriots, if a guy doesn't practice on Friday, does that typically suggest he's not playing? I mean, what kind of clues can we get if, say, Alshon Jeffery's out there tomorrow and Fletcher Cox isn't?
It's a little bit tricky depending on injury. We sometimes, for example, with a concussion protocol, which is a very specific protocol that it takes at least 5 days to get through. When you see players that aren't on the field fast enough, then you can kind of predict, well, they're definitely not going to be playing this Sunday. They're not far enough along in the concussion protocol to get back on the field. It's a little bit tricky with other injuries. Sometimes we will see players that are veterans that have a lot of experience rest an injury over the course of an entire week and still get out there on game day, and it's possible. And that's usually like those kind of soft tissue injuries, something like Fletcher Cox's, where it's safe to play. It just may be painful. So they would rather give him as much rest as possible to let that thing heal and rest. So that way when he gets out in the field, if he's going to play through pain, it's going to be on game day, not during practice. Other injuries like a surgical rehab like Alshon Jeffery's going through to just see him doing individual drills and doing limited participation at this stage just tells you he's advancing in the stage, but there will be less likely a huge change in the amount of activity he's doing in the short term. It's going to take a little bit more time to see him ramp back up.
Okay, that's today's injury report brought to you by Cape Regional Health System and Dr. Kevin McHale with Penn Orthopedics and Cape Regional. The best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. And for some reason, we keep getting new injuries, and we get a lot of things to talk about, which makes this a very informative segment. We got to stop getting these injuries, man. They continues to kill the Eagles, including Jalen Reagor. Well, how long is that? They're saying maybe week 9?
Yeah, that's what they're saying. I mean, typically about 6 weeks, so it's possible that it might not be till after the bye. But he's fooled us before and got back in the field faster. So hopefully we'll see him sooner than that.
All right, Doc. We'll talk to you next week.
All right, we'll talk to you guys soon.
All right, he appeared like all guests via the Boardwalk Honda hotline.